We recently introduced a new ebook titled The Game of the Decade, 7 Plays for Winning the Most Important 10 Years to Retirement Success. We then started this mini-series here on the podcast as we walked through these 7 plays. It started with episode 29, where I walked through each of the 7 plays. This now takes us up to play number 6, Planning for Healthcare in Retirement. Do you want to get the ebook now? If so, head on over to makeitpersonalpodcast.com, where you can download it, as well as our first ebook. While you're there, you can learn more what it's like to engage with one of our advisors, or even schedule a no-obligation conversation with one of them so they can help you develop that personalized plan. My name is Mark Zagurski, and I'm the Director of Strategy and Communications for Mutual of Omaha Advisors, a division of Mutual of Omaha. Mutual of Omaha has been helping Medicare-age consumers protect their health and their finances since 1966, the year the Medicare program began. Today, our Mutual of Omaha advisors have various options available from many of the top insurers in the senior health insurance space, as our goal is to help more people completely address their financial needs. On to play number 6, Planning for Healthcare in Retirement. Growing older often comes with a few health hiccups. Healthcare options in retirement, from Medicare to long-term care insurance, required forward-thinking defense strategies to guard against high costs that could quickly erode your retirement savings. If you plan for different scenarios and make sure that you have enough resources available for the road ahead, you should be able to tackle whatever life sends your way. Most people are familiar with Medicare and how it can help them absorb some of the costs of growing old. Medicare planning is a critical component of a retirement strategy. You're only getting older, and with that fact comes new challenges. With multiple options available, retirees must carefully weigh each one to ensure that they have the coverage that best aligns with their healthcare needs and budget. Medicare Part A, hospital insurance, and Medicare Part B, medical insurance, are the foundation of the Medicare system, offering essential coverage for healthcare services like hospital stays, doctor visits, and outpatient care. Together, these two parts provide a baseline level of protection against common healthcare expenses retirees face. Furthermore, not everyone's eligible for Medicare. That means if you don't qualify, you need a plan as well. Part A is generally premium-free for those who paid Medicare taxes during their working years, making it a key benefit that most retirees automatically take advantage of. Part B, on the other hand, comes with a monthly premium, which varies depending on your income. For many retirees, enrolling in Part A and Part B is a first step towards building a reliable healthcare safety net. However, Original Medicare, both Parts A and B, has its limitations. It doesn't cover everything, and gaps in coverage, like prescription drugs, dental, vision, hearing, and long-term care, can lead to significant out-of-pocket expenses. That's where additional coverage options come into play. It's important to understand the 2 main paths for enhancing your Medicare coverage: Medicare Supplement or Medigap plans, and Medicare Advantage or Part C plans. An advisor can help you consider how to customize Medicare to meet your healthcare needs, weighing the pros and cons of coverage through the federally run Original Medicare program or through a private Medicare Advantage plan. Things such as prescription drug coverage, choice of doctors, and ability to get coverage when you travel will differ. Sitting down with an advisor to compare the features of each option can enable you to make an informed decision. If understanding Original Medicare, Medicare Supplement, and Medicare Advantage isn't enough for you, wait till you meet IRMAA. Who's IRMAA, you ask? IRMAA, or IRMAA, stands for Income-Related Monthly Adjustment Amount. And you thought maybe IRMAA was part of the official list of Atlantic hurricane names for the 2025 season. No, IRMAA is a very fancy way of saying, congrats on your financial success, now fork it over. You made too much money 2 years ago. Ding, 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 you win an extra Medicare premium. Here's how it works. The Social Security Administration reviews your IRS return from 2 years prior to determine your modified adjusted gross income, or MAGI. If your MAGI is above a certain limit, IRMAA is added to your regular Medicare Part B and our Part D premiums. We'll leave it at that for now, though I can see an episode dedicated exclusively to IRMAA coming to a podcasting platform near you in the future. Beyond health insurance, you should also consider a plan for long-term care. Long-term care insurance is crucial for protecting against the financial burden of extended health care, which could drain a retirement nest egg. Hybrid policies, which combine life and long-term care benefits, offer additional flexibility, like a defense with coverage options for different situations. Standalone policies may provide a lower cost, straightforward approach, but they're effective only when they're needed. Furthermore, waiting too long to purchase long-term care insurance increases costs and health requirements, becoming stricter. Early planning helps retirees lock in early, lower premiums and ensure that they're covered when the time comes. In episode 28, we covered 4 ways to pay for the cost of long-term care. As we wrap up this episode, I'd circle back to episode 28 if you do not yet have a plan for long-term care. None of us can predict the future, but fortunately, we don't need a crystal ball to understand our eventual needs. Retirees should prepare for future health needs and costs using tools like Mutual of Omaha's Long-Term Care Needs Calculator. This proactive approach allows retirees to estimate potential expenses and adjust their strategies accordingly. Where would you like to spend the last years of your life when you can no longer care for yourself? What is your plan for healthcare and retirement? Does your employer provide any health or medical-related benefits that will extend beyond your retirement? What role will Medicare play in your plans during retirement? Answering these questions and having and developing a plan for healthcare and retirement is solvable with the help of a financial advisor. The thing about personal finance is, well, it's personal. If you want your plan to be personal, it has to be tailored to you. It's never too early or too late to create a plan to give you the financial security and freedom you deserve. Take control of your future and schedule a no-obligation consultation with one of our advisors today. Go to www.makeitpersonalpodcast.com to learn more or to get connected with one of our advisors. There you can also download our ebook and even subscribe to our monthly newsletter. Also, please like and subscribe. At Mutual of Omaha Advisors, we understand that personal finance is personal and financial well-being is essential to achieving your life's goals. Our vision is for every customer to be able to imagine, plan, and secure their financial futures. Make it personal. It's your money, it's your plan, it's your future.
This podcast is for educational purposes only and may include references to concepts that have legal and/or tax implications. Mutual of Omaha Investor Services, Inc. does not provide tax or legal advice. Please consult with the appropriate professional regarding your personal situation prior to making any financial decisions. Strategies discussed may not be suitable for everyone. Securities and advisory services offered through Mutual of Omaha Investor Services, Inc., member FINRA SIPC. Mutual of Omaha Advisors is a division of Mutual of Omaha Insurance Company.